Hello and welcome to Senior Living, the program on topics of interest for everyone and with information and technology to help us all age as gracefully and youthfully as possible. Today's program is going to be Your Voice and You. That may seem like an unusual topic, however, we all have a voice. And how much do you know about your voice? What it is, where it is, how it works. We're fortunate today to have with us the expert in all of that. Polly Ubben. She's a speech pathologist with some 29 years working in the field of speech pathology, currently at Balance Mobility in Lincoln, Nebraska. Something, Polly.
Thank you, Lynn. Thank you for having me. I appreciate it.
Your list of accomplishments is massive. Could you tell us something about your professional background?
Oh, of course. So I completed all of my schooling in Iowa and Colorado. So I have a master's degree in communication disorders. And I've worked across the spectrum of care, from long-term care facilities to rehabilitation centers, acute care hospital, which I was working in for over 20 years over at St. Elizabeth, and I still cover there periodically. Mm-hmm. And I am also in outpatient therapy. So I have just had a broad spectrum of experience that I'm so glad I have.
Yes, and so are we.
Yeah, great.
Well, then let's get started. Number one, let's talk about the voice anatomy, how it works. We take speaking for granted until something happens.
Yes, absolutely.
And so then we start to wonder. We will be looking at a diagram today, the anatomy of the voice. And could you just start and talk to us about it?
Absolutely, Lynn. So the anatomy and physiology of the voice box is actually really complex. It's made up of a system of cartilages and innervated by the vagus nerve. And we have a series of tiny little muscles that all have to work together, and not just with each other, but with the amount of airflow and control we have with that airflow. So it's actually pretty complex. We've been studying voice for decades, and we still don't know all there is to know about vocal problems and even how we manipulate those muscles to sing, to cough, to swallow. There's all sorts of function in that area of our bodies.
So looking at this diagram, could you explain a little bit about, I know things that I learned about the esophagus and the larynx, and how they share a wall, and it's also interesting.
Yeah, sure, of course. So the vocal folds are positioned at the very top of the airway, and they're protected by what's called the thyroid cartilage, and that's what everybody says, oh, this is my voice box. So that's that big cartilage in the diagram. Inside that are the vocal folds. They form a V formation, and they come together, and the air that's coming from underneath them causes them to vibrate and create sound. Now, there's one set of muscles that opens the vocal folds and two sets of muscles that close the vocal folds, because the primary purpose actually of your vocal folds is to protect your airway. They're the last defense your body has before something ends up in your lungs. So we're just lucky to be able to sing and laugh and talk with that mechanism that's really there for airway protection.
So there are basically two lines. One is for the air and one is for the esophagus?
Correct. So the voice box is in the front part of the neck, and the esophagus is positioned right behind the voice box. So that's why when someone has a little bit of trouble with acid reflux, which we'll get into, they have some issues with their voice, and they can go hoarse or start coughing because of that relationship to each other right next to one another. Yeah. When we're babies, our voice boxes are very, very small, and they're positioned really high in the throat. And as we age, the voice box drops. Our pitch gets deeper in general because our vocal folds grow. And in particular at puberty, boys' voices drop by at least an octave. So can you imagine how frustrating that is? And that's why they sound squeaky, because they're trying to have this system they're trying to control that has suddenly changed. Then as we get older, we also can experience muscle-related changes. Our muscles thin out a little bit. It's called sarcopenia. And so that's why our nice big muscles on our 20s aren't there when we're older in our 50s, 60s, 70s, beyond.
Atrophy.
Atrophy, exactly. Yes.
Wow.
So,
That's interesting.
yeah.
So, so the muscles of the larynx,
Mhm.
how do they work with the voice?
Yeah, so because there are a number of different muscles that are in the vocal folds themselves, as well as muscles that are controlling the opening, the closing, and the tension in the system, there are a number of different combinations of muscle patterns that can occur. Basically, when you go to voice, you use power from your diaphragm, and air comes up. Vocal folds are in position next to each other, and they are blown open from the bottom up. Then that airflow pressure changes and they're sucked back together again, creating a cycle of vibration. And this cycle is really fast. We actually can't see it with a naked eye. To really look at vocal fold vibration, to look at the health of vocal folds, we have to slow that down through the use of a strobe light. And so, for example, females can have a pitch range from 160 hertz to 260 hertz. That's 260 separate vibrations in 1 second. Males are lower, they have deeper voices, so their vocal folds generally vibrate slower. But interestingly enough, as we age, female voices begin to drop in the later years and men's voices begin to rise. Do you have any idea why?
Mm-mm.
Changes in estrogen levels and testosterone levels as we age. So postmenopausal women have different hormonal levels than they did when they were in their 20s.
Wow. This is so amazing. We know so much more already.
Yeah.
And what a miracle design that God has created as far as our voice and how it works.
Yeah, it's fascinating,
It
and what a
really is.
gift. And everyone deserves a voice.
Absolutely.
Yeah.
So, question number 2.
Yes.
What can go wrong? Many things, I am sure. Like when I came down with laryngitis not too long ago, and that's how we met.
Mm-hmm.
And then suddenly, things were terribly wrong for me. And I have a coworker recently who hasn't had a voice for 2 or 3 weeks.
Wow.
I know, and I told her, you can go to voice therapy.
Yeah. Yeah, that's a long time to be hoarse.
That surprised her. I think she took a few days off and went to Phoenix, and I think that helped.
Oh yes, that would help.
Anyway, so tell us about that. All the things: reflux, trauma, overuse, viral illness,
Yeah.
thyroid cancer.
Yeah.
Where can we start?
Yeah, where do we start, right? So a myriad of things can go wrong, and luckily we, for the most part, do fairly well. But you can have issues with, like we were speaking about before, that stomach acid coming up, and because the opening to the esophagus is right behind that vocal fold area, that stomach acid can come in and irritate and inflame the tissues, which are very delicate mucous membranes around the voice box. And interestingly, the voice box has special chemical receptors looking for that stomach acid, because if that got in your lungs, it would kill you. It actually melts lung tissue. And so the minute your system picks up on that and it starts to get inflamed, you may start coughing or noticing you have to clear your throat a lot, or you've got a lot of throat mucus that you've been dealing with. That stomach acid can also cause things to go wrong in terms of your breathing. So we have a condition called vocal cord dysfunction, or paradoxical vocal cord motion, and that's where the vocal cords don't want to stay open when you try to breathe in. They actually try to shut so that they don't let that stomach acid into the airway. That's one of the causes of this breathing issue people can get. And so what happens is you go to breathe in and you can't get enough air in, or you have a spectrum of issues where maybe you do a lot of throat clearing, and then maybe a little more severely, some people might have a chronic cough, and then a little more severely, they might have a sound on inhale because the cords are in the way, like that kind of sound. And then at the far end of the spectrum is an actual spasm that can shut your airway down.
There's a term for that,
Yes.
and I have actually experienced that.
Have you really?
And so, in talking with the other lady at your office,
Yeah.
and she said it's far more common than one would expect.
Yes, I see a lot of people with it actually. So the two causes typically, reflux is one, stress is another. And so we see the issue not just with a chemical, trigger, but some people get so much irritation that they trigger with other things like odors, scents, like cleaners. They can't walk down a perfume aisle without having issues. Then you can have athletes have trouble because of stress, and every level of competition in the athletic world brings more of that, and they're working at a higher level, so their airway is working really hard to stay open, and they can even develop these laryngospasm type events, but for very different reasons.
Wow.
So those are some things that go wrong. Other things are allergies. Allergies can irritate your vocal folds, so you can get hoarse with that. And the treatment for allergies, that's one thing, medications can impact your voice. Decongestants dry you out a little bit, and so do antihistamines. Inhalers also can cause hoarseness and irritation if you don't use your inhaler correctly, or you don't, get that nice breath in with the diaphragm and you tense your throat instead. You can have neurologic conditions. Those commonly are things like multiple sclerosis or Parkinson's disease. Those things can cause changes in voice where you get weakening voice, you lose volume. And what happens is, instead of the vocal folds coming together nicely like this, they start bowing in those people that have Parkinson's, which also is very similar to what happens with aging. That bowing of those vocal folds is that sarcopenia change in that muscle, and that causes air loss and loss of power. Then we also have thyroid conditions. So the thyroid gland overlays the thyroid cartilage. It's actually a little bit lower in the middle, and then the wings of the thyroid gland are on the sides. But you can get nodules there that can press on laryngeal nerves and cause issues with those vocal folds closing when you swallow, or even paralyzing a vocal cord if something's pressing up against one side. Thyroid conditions with high or low levels of thyroid hormone circulating can cause the tissues of the vocal fold to roughen. So there's even that kind of element. What else? We have, the viral illnesses. If you've ever heard of Bell's palsy, where you have one side of your face paralyzed, we can actually have viral illnesses that cause one of the vocal folds to paralyze for a while. And that could last indefinitely, or it could be a short-term issue that you have to deal with. Cancers, obviously, if the laryngeal cancers have actually been tied to reflux as one of the risk factors, and smoking. And then obviously too much alcohol in combination with those things can cause laryngeal cancers. And I work with people that have had their entire voice box removed even. So we're teaching them how to communicate without vocal folds using an electrolarynx.
Oh my Lord.
It's pretty life-changing. Inflammatory conditions like autoimmune disorders can also cause issues with vocal folds. So if you have arthritis, think about the little joints in all those little cartilages in the larynx. They get inflamed and you can have voice change.
So arthritis is not just hands or...
No.
Wow.
Yeah.
I thought of that.
Yeah, so there's a lot of different things there. And then we can have other things like functional disorders. So somebody may start to use their voice differently. Just pushing a little bit more from one set of muscle groups creates a little bit of a tug of war in there between the two muscles. And they start to experience hoarseness, raspiness, and that can snowball. So you can have change from that.
Singers?
Singers, absolutely. Overuse and misuse. The common error people make is they start pushing from their throat and they don't use their diaphragm like they should. And that's really where our power comes from. But when someone starts to have trouble, they go to the wrong spot.
Which brings us to a good point about breathing properly.
Yes,
Because
absolutely.
we were talking about that what is the proper method of breathing?
Yeah, so excellent, Lynn, because that is really the foundation of our voice, and that's a lot of what I do in my job to correct some of these muscle pattern issues. So we want to maximize abdominal breathing patterns. When you breathe in, your diaphragm is actually a dome-shaped muscle at the bottom of your rib cage that goes down. So a good abdominal breath in will actually, if I put my hand just below my rib cage, kind of where the edges are, when I breathe in, my hand will go forward. So I always tell people, picture a little ball there. Yeah, because your diaphragm's going to push that hand out of the way as it comes down. And then as you breathe out, your diaphragm will come back up and the hand comes back in. Yeah.
I know we are a nation of shallow breathers.
Yes.
And so this is very important.
Yeah.
Proper breathing.
Yes, it is.
So, as we said, a lot of possible issues. Inflammatory, you mentioned, functional disorders, vocal cord dysfunction. What is that?
Yeah, so that's that VCD, or paradoxical vocal cord motion. So that's more of the presenting factors are typically more cough, chronic throat clearing, difficulty getting air in, those types of issues. And again, common triggers are reflux and stress, but it can sort of build on itself, and you get what's called an irritated or irritable larynx, where the smallest little thing then starts to make you cough because everything's inflamed and angry. And so some people even start coughing when they laugh or when they talk.
And that's one thing I learned initially is that how often do you clear your throat?
Right.
And I went, oh, I never, she just, well, I just heard you do it 4 times. And we don't even realize that we're doing that, and that's damaging.
Absolutely. So the
Throat clearing.
Yeah, and throat clearing is interesting because the more you do it, the more you will do it. So every time you clear your throat, your vocal folds are coming together, and it can create a little friction and irritation. Guess what that little mucous membrane does to protect itself? It starts to create mucus.
Oh.
So you think you have a little mucus, you start clearing your throat, start clearing more, then you create more mucus because the mucosal layer is trying to protect itself, and then you're in trouble.
Wow.
Yeah.
Golly, it is so involved. So, and how common is voice disorder?
Yeah, so voice disorders are actually fairly common. When you look at statistics, and you can look this up on the American Speech and Hearing Association website, there's actually data from 2022, and there's a lot of good information about the frequency of voice disorders. And I brought some papers so I don't misquote this.
Okay.
But in the general population, children annually, it's a percentage of 1.5 to 6% of children will have some sort of voice problem. And in adults, about 1 in 13 people will have a voice problem in any given year. The problem is only 10% of those people seek treatment. Once you get over the age of 60, that increases. So you have more things that can go wrong as we get older that can add to that problem, and the prevalence is between 4.5% and 29% in the prevalence. It's greater in boys than girls, and then as adulthood, when you get to adulthood, then it shifts. However, males are more likely to have a chronic voice disorder or a laryngeal cancer than females. Yeah. And you think about it, Lynn, like, okay, people have a voice disorder. Okay, they sound a little different. Well, it can be a cancer issue. It can be your life, right? But the other thing is, it has an economic impact too. And there's some really great data by doctors Ramig and Vertolini, and I've been tracking their every time they publish the information. And so what they did is they looked at teachers in particular and the amount of money that's lost annually in the United States from teachers having voice problems. So teachers are 2 to 3 times more likely to have a voice problem because they need their voice so much.
Exactly.
And so when you have a teacher that on average, and these are just the ones that seek treatment or have to be off work because of it, and there's even more than that are staying in their jobs, but you have a loss of like $1.4 billion a year.
Wow.
And then if you add the cost of adding subs in for teachers, it ends up skyrocketing to over $3 billion a year in economic impact.
Golly. Well, then important question number 3.
Yeah.
What can we do? How to keep a healthy voice?
Absolutely. So we call this this part vocal hygiene, and so these are things we should all do for our voices every day. Try not to talk over background noise if at all possible. Try to rest your voice frequently, especially if you're having to project. Some bad acoustics are out there in restaurants or if you're outside and talking, because the sound waves either don't have something to bounce off of and are lost, or there's too many surfaces and too many sound waves bouncing around like in the restaurants. We don't drink enough water, right? And so we have our water here. Yep, and that's very important as well. So beyond that, making sure you take care of stress, that you manage any symptoms or talk to your doctor about symptoms of reflux or allergies, and maybe take a close look at medications with your provider. And those are some simple things that you can do for your voice.
And others, like do not yell or scream.
Yes, we in the college ages we call it the weekend college voice. They
That's
go
right,
out
after a big game.
Yep, that's right.
Stay hydrated, avoid alcohol, as you
Yeah.
said, control stress, rest. What you wouldn't think it, but loud whispering is a problem.
Yeah, and so this has been studied a lot. Like a lot of the voice symposiums I've been to have tracked some of those elements of how we whisper, and the jury is kind of out on it. So right now we say just don't whisper. Instead, use what we call a confidential voice. It's a voice you'd use in a restaurant if you didn't want the next table to hear you, because some people whisper with a lot of tension in their throat, and others don't have that tension. So we just say in general, avoid it.
Okay, and holding your breath.
Holding your breath, yes.
Isn't that was a fad on TikTok or somewhere?
Oh yes, there's a lot of interesting fads on TikTok. Breath holding is interesting. Some people do it and they don't realize they're doing it, like with stress, and they just kind of hold their breath, And if you follow a weight-lifting regimen to keep those muscles to not have so much change as we age, you can be holding your breath when you go to lift something heavy, and that can actually impact your voice. So you always want to blow out on that active phase. So who knew you'd have to think about that
When you're lifting.
when you're lifting weights for your arms or legs.
Or lifting at home.
Or lifting at home.
Or the children or the grandchildren.
Yes, absolutely.
All of that.
Yeah.
Well, some of the things I learned that you can do for health, good vocal health, raise the head of the bed. Now, what is the importance of that?
Yeah.
Like, I raised mine like 3 or 4 inches with blocks.
Excellent, yes. And gastroenterologists will tell people the blocks work. A lot of propping up on pillows, that kind of thing, it doesn't work very well. So the blocks really help. So the other thing that you're doing is you're positioning, if you have something in your stomach and you're laying flat, you have more of a chance of that stomach acid coming up and into your throat than if you sleep at an angle and use gravity to keep it down. Along with that, it's probably best not to eat within 3 hours of bedtime so your stomach doesn't have food in it at the time you lay down.
I know lying prone, for 8 hours
Mm-hmm.
during the night can do a lot of damage in a way.
Yes. Yep, all that pressure.
So that's interesting.
Yeah.
And then I also was told eat small, frequent meals.
Yeah, and so that's to make sure you don't overfill your stomach, and then if you have something else you need to be doing, or you bend down to pick up your kids, or your grandkids, I should say, you're more likely to push something up from your stomach. There's valves that try to keep that down and keep it away from your airway in the bottom and the top of your esophagus, but they don't always keep everything there. Yeah.
And you said do not eat 2 to 3 hours before bedtime.
Yeah, and that's again for that stomach emptying, because it can take up to 3, and in some people 4 hours for their stomach to empty after it's digested the food you've eaten.
Do not smoke.
Do not smoke, absolutely. So smoking does a lot of damage to the vocal folds. There's heat, there's chemicals in the smoke particles, and for obvious reasons, it affects your breathing and your nice breath support. But smoking can dry things out and cause cancers.
I was reading that we are more healthy now because of more people not smoking.
Oh,
I read that
sure.
today.
Yeah.
And you said, of course, control stress.
Easier said than done, right?
Exactly.
Yeah. So I encourage people to use self-care. We don't do enough of that in our busy lifestyles. Even in our senior years, I watched my grandfather become more busy after he retired, serving on committees and volunteering and being active with his grandkids.
And that happens a lot.
Yeah. Yeah,
So,
for sure.
well, this sounds like a good, healthy program for the voice.
Absolutely. And what I would say, just so that this information is there, is if you are hoarse for more than 2 weeks, you definitely need to see your physician. It's not normal to be hoarse for more than 2 weeks.
Mm-hmm.
Yeah.
And that would be your GP or
Yep.
an ear, nose, and throat.
Yeah, so you can see your general practitioner or your primary care physician, and a lot of times they will refer you to an ear, nose, and throat physician, and they can use a little camera and look down there. They actually look through your nose and down into your throat, and then they're able to see what's
I did
going on.
undergo that.
What did you think?
Well, it was a little scary beforehand, but it worked out fine, and wonderful doctor. And then he's the one who said, why don't you go to voice therapy?
Yeah, yeah. And a lot of people say, well, I'm a speech pathologist, so they say, speech therapy? I don't need a speech therapist. What is that for? And so that's because a lot of people don't understand what we do in our profession.
Well, this has been a great program. Thank you to our special guests for all that we have learned today. It's amazing. And thank you for watching Senior Living. Please join us again next time for another important topic of interest. And until we meet again, this is Lynn Brennan saying goodbye for now, happy, healthy aging, and God bless.